Hi there, this is Nursing Education Videos. Today I will be going over stroke NCLEX review on registerednursern.com. I will be reading the review notes. I hope this information is helpful for your learning. All credit for this information that I am reading goes to Sarah at registerednursern.com. Again, all credit for the information that I am reading goes to Sarah at registerednursern.com. Please refer to the websites in the description box for all credit and information. Links for the information will be included in the description box. This NCLEX review will discuss stroke, (CVA), also called cerebrovascular accident. As a nursing student, you must be familiar with this neuro disease, along with how to provide care to a patient experiencing this condition. Don't forget to take the stroke quiz. You will learn the following from this NCLEX review: definition of a stroke, pathophysiology, signs and symptoms, nursing interventions, medications, and treatments. Cerebrovascular accident, (CVA), stroke NCLEX review. What is a stroke? It is a condition that develops when blood rich in oxygen cannot reach brain cells, (due to either a blockage or bleeding). This causes the brain cells to die. Types of stroke: ischemic stroke and hemorrhagic stroke. So ischemic, which is the most common, so it says here most common, due to a blood clot within a blood vessel or stenosis of an artery that feeds the brain tissue. This limits the blood that can reach the brain cells. This type of stroke can happen due to embolism, where a clot has left a part of the body. So for example, the heart. This can happen due to a heart valve problem or atrial fibrillation. So it's in brackets here. The clot develops in the heart and travels to the brain, which stops blood flow. And the next one is thrombosis. It's still in the ischemic. So it's where the clot forms within the artery wall, within the neck or brain. This is seen in patients with hyperlipidemia or atherosclerosis. And then the next type of stroke is hemorrhagic. This occurs when there is bleeding in the brain due to a break in a blood vessel. Therefore, no blood will perfuse to the brain cells. In addition, this can lead to excessive swelling from the leakage of blood in the brain. Causes of this type of stroke includes rupture of a brain aneurysm, uncontrolled hypertension, or aging blood vessels, older age. TIA, so this is in brackets, it's a transient ischemic attack, also called a mini stroke. This is where signs and symptoms of a stroke occurs but last only a few minutes to hours and resolves. It is a warning sign. So it says here, it is a warning signs and impending stroke may occur. If this occurs, the patient needs to seek treatment. To understand strokes, let's talk about the brain's function and anatomy. Blood supply to the brain. The blood supply to the brain comes comes from the carotid and vertebral arteries, which then branch into other arteries that feed the brain. If any of these areas of the artery becomes blocked or burst open, it decreases the blood supply to the brain cells. Brain cells are very sensitive, and within 5 minutes, these cells start to become damaged, and the damage can become irreversible. The cells in the brain control how our body functions, and depending on where the cells are located, they are responsible for specific functions. Therefore, it is super important to be familiar with the function of each lobe and the difference between the right and left hemispheres of the brain. Let's look at the lobes of the brain and their functions. Now, strokes tend to affect one side of the body, so be familiar with the functions of the right side versus the left side. The right side of the brain is the creative side, while the left side is the logical side. Right side functions, which are attention span, so attention span, showing emotions, abilities to solve everyday problems by making decisions/plans, reasoning, brackets, understanding jokes, reading in between the lines, bracket, and making judgment calls, memory, music/art awareness, and controlling the left side of the body. If a patient has right side brain damage, what do you think the patient will experience? Left side weakness, hemiplegia, impairment in creativity, arts and music, confused on date, time, and place, cannot recognize faces or the person's name, loss of depth perception, trouble staying on topic when talking, can't see things on the left side neglect, which is unilateral neglect, ignores the left side of the body, trouble with maintaining proper grooming, emotionally not going to think things through, very impulsive, poor ability to make decisions and assessing spatial qualities such as shapes, denial about limitations, not able to read nonverbal language or understand the hidden meanings of things, very short attention span. The next one, left side functions, which are speaking, writing, reading, math skills, analyzing info, and planning. If a patient has left side brain damage, what do you think the patient will experience? Right side hemiplegia, aphasia, which is trouble formulating words and comprehending them. So this is in brackets. And then aware of their limits, experiences depression, anger, frustration, trouble understanding written text. They can't write, and this is in brackets, agraphia, impaired math skills, memory intact, issues with seeing on the right side. So as you can see, when there is brain cell death in a certain area, it will cause specific signs and symptoms. The amount of brain damage depends on how long it took for blood to return to the affected brain cells. Risk factors for stroke. Be familiar the risk factors and which ones are modifiable. Things a person can change versus unmodifiable. Things a person can't change. The mnemonic is strokes happen. S for smoking. T for thinners, in brackets blood, bracket. And then R for rhythm changes, bracket, AFib/flutter, bracket, O for oral contraceptive, K for kin, brackets family history, bracket, E for excessive weight, S for senior citizens, H for hypertension, A for atherosclerosis, P for physical inactivity, P for previous TIA, which is transient ischemic attack, E for elevated blood sugar, which is bracket diabetes mellitus, and then N is the second letter of aneurysm, which is in brackets of brain. Brackets. Signs and symptoms of a stroke. It happens suddenly. Need to act fast as the nurse to help save brain cells. Call rapid response so patient can receive appropriate treatment or call 911. Bracket, if outside the hospital in the United States, bracket. Note, the exact time the signs and symptoms appears, important for stroke treatment. Learn to recognize the signs of a stroke. The mnemonic is fast. F for face, where drooping or uneven smile. A for arm, numbness, weakness, drift. And this is in brackets where raise both arms. S for speech, can't repeat a phrase, slurred speech. T for time, to call rapid response and note the time. An asterisk, National Stroke Association recommends using the mnemonic FAST, F-A-S-T, to help assess for signs and symptoms quickly. The patient can also have the following as well: bowel and bladder incontinence or retention. Important stroke terms. Remember these terms because exams love to ask about them. Aphasia, unable to speak, and this in brackets comprehending or producing it. Receptive aphasia, unable to comprehend speech. This is called Wernicke's area. Expressive aphasia, comprehends speech but can't respond back with the correct words, if at all. Wernicke's area earlier was in brackets, and Broca's area is in brackets. Mixed aphasia, combination of the two types of aphasia. Global aphasia, complete inability to understand speech or produce it. Next is dysarthria, unable to hear speech clearly due to weak muscles. And this is in brackets, hard to understand the patient's speech, it may be slurred. Apraxia, can't perform voluntarily movements. In brackets, winking / moving arm to scratch an itch. Brackets, even though muscles function is normal. Agraphia is lost the ability to write. Alexia, lost the ability to read, doesn't understand or recognize the words. Agnosia, doesn't understand sensations or recognize known objects or people. Dysphagia, issues swallowing, brackets, weak muscles, brackets. Hemianopia, which is limited vision in half of the vision field. Hemiparesis, weakness on one side of the body. Diagnosed with CT scan or MRI. Medications for ischemic strokes. TPA, which is tissue plasminogen activator, for ischemia strokes only, not hemorrhagic. How does it work? It dissolves the clot within the blood vessel by activating the protein that causes fibrinolysis. Remember, it must be given within 3 hours from the onset of stroke symptoms. It can be given 3 to 4.5 hours after onset if strict criteria is met. To receive TPA, the patient should have a CT of the head that is negative for hemorrhage, labs within normal limits such as the glucose, INR, and platelets. Blood pressure needs to be controlled, systolic blood pressure less than 185 and diastolic blood pressure less than 110. Glucose controlled because that, in brackets here, it increases risk or increases rise of hemorrhage. This might be increased risk of hemorrhage. Not receiving heparin or other types of anticoagulants. Nurse's role: monitor for bleeding, neural checks around the clock, blood pressure medication if needed for hypertension, vital signs, labs, glucose, preventing injury, in brackets here, bed rest. Avoid unnecessary venipunctures, avoid intramuscular injections. Will go to the ICU, which is intensive care unit, to be monitored. Nursing interventions for stroke. Monitor vital signs and neural status, especially blood pressure. In brackets here, notify MD, which is the medical doctor, if it is hypertensive. Airway, brackets, difficulty swallowing, at risk for aspiration, height of bed 30 degrees with suction at bedside. Turn every 2 hours with proper alignment and watch for increased intracranial pressure, which is the ICP, during acute stage. Headache, nausea, and vomiting, increased blood pressure and decreased heart rate and decreased respiration rates. Decrease in mental status from baseline. Pupils don't respond. Assess with the NIH stroke scale. I think this is the National Institute of Health stroke scale. So I double checked here. Yes, it is the National Institutes of Health Stroke Scale. Score ranges from 0 to 42. 0 is no stroke symptoms. 21 to 42 is severe symptoms. 11 assessments area are scored. It assesses level of consciousness, gaze, visual, facial, palsy, motor function of extremities, sensory, best language, dysarthria, and extinction/inattention. Check cranial nerves, pupil responses, motor function, gag reflex. Monitor bowel and bladder function, may be incontinent or retaining. Passive range of motion, so it's ROM, with extremities and preventing contractions. Interventions for aphasia. Communication is key. Just because the patient can't communicate doesn't mean they have a mental deficit. This is in brackets. They just can't get it out, and it takes them time. The nurse's role is to help bridge the gap and make it less frustrating for the patient. Receptive aphasia. Unable to comprehend speech. In brackets is Wernicke's area. Use short phrases. Use gestures or point while giving a command. Be patient and not expect a fast response. Remove distractions. Expressive aphasia. Comprehend speech but can't respond back with speech. This is in brackets, which is Broca's area. Be patient and let them speak. Be direct and simple when asking questions. Give options. Communication via a dry erase board. Stroke care is a multidisciplinary approach. Need to involve family as much as possible because they will be providing care when patient is discharged. In addition, it is important to always be communicating with the speech-language pathologist, physical therapy, and occupational therapy, etc. Diet. Evaluated by speech-language pathologists. May need thickened liquids and mechanical soft foods. Assist with eating and monitor for pouching of food in cheek on the affected side. This increases risk of aspiration. Have patient tuck in chin to their chest while swallowing. Watch for neglect syndrome. Tends to happen in right side brain damage. The patient is at risk for injury because patient ignores the affected side. Remind patient to use and touch both sides of the body daily. Must make a conscious effort to do so. This is in brackets. And then educate the patient about the importance of turning heads side to side to prevent injuring the affected side. Hemianopsia intervention. So hemianopsia interventions. Turning head side to side to see all visual fields to prevent injury. References for this information is How is stroke diagnosed? NHLBI, NIH, NHLBI.nih.gov, retrieved 5 December 2017 from www.nhlbi.nih.gov/HEALTH/TOPICS/TOPICS/DIAGNOSIS. Second reference is NIH Stroke Scale Booklet, retrieved from stroke.nih.gov/NIH_STROKE_STROKLET.pdf. And reference number 3, Stroke Information, cdc.gov.cdc.gov, retrieved 4 December 2017 from www.cdc.gov/STROKE/. I hope that information was helpful. Thank you for listening, and I hope it was engaging as well. Please feel free to subscribe and click the like button and go to registerednursern.com for more information and check out the YouTube channel. Thank you for listening again. I hope everyone has a great day.